Hi everyone, this is Manish Giandani. I am part of the Health Cloud Product Management team here at Salesforce. I'm here to share with you the exciting updates that we are delivering to the intelligent document automation capability as a part of Health Cloud in the Spring 21 release. Let's jump right in.
Document management is a key pain point, especially in highly regulated industries like healthcare. A staggering 75% of all medical communication occurs via fax. The healthcare industry prints 110 million pages every year. As you can imagine, with such manual processes around document intake and processing, it is no wonder that healthcare organizations spend a lot of resources to manage documents in their organizations. This manual tracking of documents creates friction within and outside healthcare organizations, leading to delays in delivering care to patients, delays in enrolling them in care programs, and so forth. Document management pain points are caused by multiple disconnected enterprise systems, hard to automate business processes. These challenges lead to a lack of transparency, poor efficiency, and high error rates due to these manual processes. To lower administrative costs, minimize costly errors, and improve the patient experience, organizations need to digitize and centralize document management. We introduced intelligent document automation in the Winter 21 release. To recap, with intelligent document automation, customers can easily manage, rapidly transform, and process documents all within a HIPAA compliant digital workspace. Intelligent document automation enables our customers to unify the document process, say goodbye to multiple tools, and leverage a single workspace to manage patient member documents, coordinate document intake, leverage document queues to intelligently route documents to the right owner, improve accuracy and efficiency, apply document checklists to ensure all relevant documents for a process are collected, and new in the Spring 21 release, we are launching the Intelligent Form Reader in partnership with AWS Textract. Intelligent Form Reader allows customers to automatically extract data from documents and map this data to Salesforce records. Intelligent Form Reader, in partnership with AWS Textract, can be leveraged to route the faxed documents to the right queue. For example, documents from a zip code or a specific provider or a specific specialty can be routed to the appropriate queue for quick and efficient processing. By extracting data from documents and mapping it to Salesforce records, customers can avoid the errors and inefficiency associated with manually entering this data from documents. Intelligent Form Reader with Amazon Textract supports both typed forms as well as handwritten forms. Intelligent Form Reader with AWS Textract is a new product that requires a separate license. We have also added new innovations on top of Intelligent Form Reader. For example, end users have the flexibility to review and select values to map the data that is extracted to the Salesforce records. An example of when a data is extracted is different from the data that is already available in an entity, or when data extracted from a document is mapped to a different field in the entity. We have also added new capabilities to intelligent document automation. While transforming a document, a user can create an action plan to ensure that the right DCIs are associated with the document. When a document is transformed, a user is presented with visual cues. This is helpful in scenarios where a document might contain information about multiple patients or multiple pieces of information about the same patient. These cues help the user understand which pages in the document have already been transformed. We have also added support for new entities for intelligent document automation. Customers can now attach documents to care requests, claims, and custom entities. Just to recap what we covered today, intelligent document automation is the new innovation we launched as a part of Salesforce Health Cloud in the Winter 21 release. With intelligent document automation, customers can intake documents via document queues. They can leverage the document workspace to transform, for example, split, rotate these documents. With document checklists item, they can track documents needed for a business process. Intelligent document automation is available to all Health Cloud customers. Intelligent Form Reader with Amazon Textract is a new innovation we are launching with the Spring 21 release of Salesforce Health Cloud. Intelligent Form Reader enables customers to extract data from documents and map it to Salesforce entities. Intelligent Form Reader is an add on SKU that the Health Cloud customers can purchase. All right, let's bring this all together with a demo. Let us recap some of the capabilities of intelligent document automation. I am logged into Health Cloud as Jackie, who is a referral intake coordinator at one of the nation's leading home health agencies. As a home health agency, they receive faxes electronically. As these faxes come in, they are routed to the received document queue. However, since I work with all referrals coming in from the city of San Francisco, I'm going to work on documents that are routed into the San Francisco queue. All referral forms do not, however, come in electronically. Jackie received one in an email. She decides to upload the document from a laptop. Once the document is uploaded, she can start transforming the document. While transforming the document, she can get a quick preview of the document. She can also enlarge an individual page to see all the details of the page. She can also zoom in and out of the page. This document, like many others, has pages that are not oriented correctly. She can, with a single click, change the orientation of the page. Or, if she wants to change the orientation of all the pages in the document, she can do that as well. Now, this specific document that came in has multiple different documents about the referral in it. For example, it has the actual patient referral form, the patient's copy of insurance, and also a consent form. She can attach this document to different entities. For this document, she selects the lead entity. Jackie can easily attach these documents to an existing patient referral or create a new patient referral and attach these documents. Let us create a new referral. Now let us look at how, using action plans, Jackie can easily categorize all the documents for this patient referral. She selects page 2 and creates a new action plan. She can now select from a list of predefined document checklists. She selects referral form as the document type and selects save. The document is now attached to the patient referral record she just created. She can now see the transformed icon next to page 2. This aids in her document transformation process as she knows which pages in the documents have been already transformed. Let us transform the document again and attach the proof of insurance and the consent document. Now let us look at the patient referral record. You can see that using document checklist items, Jackie can ensure that all the required documentation is collected for this referral. If the new document comes in, she can easily replace the old document with the new one. She can also easily review the document. Leveraging the intelligent form reader with Amazon Textract, she can now review the data that has been extracted from the referral document and is mapped to the lead entity. She can see that the patient's phone information that is extracted from the document is different from the value that is already present. She can review this information and choose to copy over this new value. She can review other data elements like specialty, date of birth, provider information to make sure it is all correct. She clicks Save to commit the changes to the patient's record. Intelligent Form Reader with Amazon Textract enables Jackie to quickly and efficiently extract data from documents and populate Salesforce records without the errors associated with manual data entry. A combination of intelligent document automation and intelligent form reader enables her to quickly and easily manage and process all documentation within Salesforce Health Cloud. Processing incoming patient information quickly, efficiently, and without any errors allows for faster care delivery to the patient.
Well, that's the end of my section. I thank you for your time and listening to this presentation. Now, I will turn it over to my colleague Sumit to talk more about the Health Cloud enhancements in the Spring 21 release.
Thanks, Manish. Hi, everyone. I'm Sumit Sharan, a Director of Product Management with the Health Cloud team. I'm here to share with you some exciting new updates that we are bringing in Health Cloud as part of the Spring 21 release. So let's dive in. When Health Cloud was launched in 2016, the clinical data model in it was built using FHIR DSTU2 specs. FHIR as an interoperability standard was relatively new back then, but in a relatively short time, it has evolved a lot and has got tremendous uptake in the industry now. With the publication of new CMS and ONC rules requiring FHIR R4 standards for interoperability, there is an acceleration in healthcare industry to adopt the new FHIR standards. Today, I'm so pleased to announce that in Spring 21, we are releasing a new clinical data model for Health Cloud that is aligned to the latest FHIR R4 standards. This will enable providers and payers to seamlessly bring in clinical data from external systems into the Patient 360 platform. Now, let's get into more details about this new data model. So the new data model today supports 26 FHIR R4 resource specifications, and we plan to support a few more in our next release. To support these 26 resources, we have added 30 new entities in the Salesforce platform in core. We have also reused some of the existing entities which were already there in the core. With this, we now have the coverage across multiple modules and FHIR, including administrative, clinical, medication, diagnostics, workflow, and fundamental data. In this slide, you will see the complete list of the supported FHIR R4 resources. Note that these are names of FHIR resources, not Salesforce objects. For a full list of Salesforce objects that are part of the new clinical data model, please see the Spring 21 Health Cloud release notes. Now, though the new data model has been built using FHIR R4 standards, with the help of our middleware partners, we will also be able to support ingestion of the most common HL7 v2 messages. The list of supported HL7 v2 messages includes segments like ADT, ORM, ORU, MDM, VXU, MDM, etc. In Spring 21 release, we not only built a new data model, but we have also released field level mappings between the HL7 v2 and the new Health Cloud entities, as well as between FHIR R4 endpoints and the new Health Cloud entities. We did that because in the past, our customers and integration partners have shared the feedback that close to half of their implementation time is spent in integrations in defining field level mappings between the EHRs and the Health Cloud entities. Our partners who have seen these mappings are quite positive that the availability of these mappings would now save them at least a couple of months of implementation time. We will also now quickly touch on why we call our new data model FHIR aligned and not FHIR compliant. While the new data model very closely follows the FHIR R4 specifications, please be aware of the following minor differences. So, not all attributes in a given FHIR source may be supported. Cardinality of a few attributes have been changed, example in picklist scenarios. Some entities have additional non-FHIR attributes to increase usability of the data within the Salesforce platform. While finalizing these subtle differences, we have taken care to satisfy most of the use cases of a Health Cloud user. Now, just to recap what we covered today, we have released a new FHIR R4 aligned clinical data model using which customers and partners can extend the value of electronic health records and external systems. Customers and partners can seamlessly connect HL7v2 and FHIR R4 data to the new clinical data model in Health Cloud using the mappings which we have released. Customers can now quickly view real time clinical, diagnostic, medication, administrative data, and more, all from within Health Cloud. This brings us to the end of this virtual session. Thank you for your time and listening to this presentation.